All right, hello everyone. Thank you so much for coming to our panel today on addressing mental health in early childhood education. I'm Jackie Mader. I'm an early childhood education reporter and the multimedia editor of the Hechinger Report, which is a nonprofit education news outlet. And today we're going to talk about why mental health is so important in the early years. And by that we mean even starting with infants, toddlers, on up through preschool. I'm sure a lot of you have heard, especially recently, a lot of mental health articles or heard a lot about mental health in schools, mostly relating to high school. It seems to be where we hear a lot of this with older children. But we know that the majority of brain development happens in these first few years of life. And a lot of events and experiences can impact a child's brain development and also their health, well-being, and their mental health, which is why it's so important to start talking about this at such an early age. So today we have a fantastic panel that's going to dive into some of this brain research, talk about why it's so important to start early, talk about what schools are doing and what communities are doing to address mental health with these young children. So first I'll introduce our panel. We have Dr. Ann Mastergeorge, who is a professor and department chair in human development and family studies at Texas Tech University. So she's going to help us really ground this conversation in brain research and understand how that impacts mental health for children. Next, we have MJ Korpela, who's the family services director at Mainspring Schools. That's a preschool here in Austin, which has really embraced mental health as part of its mission with a multi-generational approach. So we'll hear what they're doing in the classrooms and outside of the classrooms to address this. And then last but not least, we have Cathy McHorse, the Vice President of Success by Six at the United Way for Greater Austin. And Cathy's very involved in a lot of programs that are trying to work on mental health in early childhood, including some that may not seem like they're directly impacting children, but they do actually trickle down and impact the mental health of children, which is a really interesting approach and something a lot of communities can embrace. So we have a lot to cover, so we're going to get started. Just a note, you can submit questions through the Slido app if you have the South by Southwest app, so feel free to do that, and I'll leave some time at the end so we can ask some questions. Ann, we're going to start with you. Can you kind of give us this background on early childhood brain development? What kinds of experiences impact brain development, and what does all this have to do with mental health?
All right, so I'll start. I'm going to do, obviously I could talk about the brain for hours and hours, so I'm going to give you a really quick version of some of the things that I think are important and also some misconceptions. So one of the things that's really important to know, that brains are built over time, and they're continuously developing. So there is never a time when brain development isn't important. It's critically important in the early years. So for example, more than 1 million new neural connections are developing every second in the early years. Think about that for a minute. There are billions of connections that are happening across the brain in the early years of development. So again, very important. Now, the brain is not the only thing that is developing. The brain is also shaped by experience. So just so you know, they're not silos. The brain isn't developing here and experience over here. One shapes the other. So for example, the slide that I have there for you that is a good example of what is so important is called serve and return. So serve and return, if you think about it, we often talk about it in terms of ping pong or tennis, whatever your game might be. And so those interactions back and forth that happen hundreds and hundreds of times a day shape brain architecture. So it helps develop neural connections. So what develops positively in the brain is when you have these sensitive, nurturing, responsive caregivers. So when a baby cries, for example, a parent responds. The baby smiles and coos, the parent responds with more smiling and cooing. So that is what is so important in terms of very early development. And these connections start to happen at the moment of birth. So it's not as if you need to wait, and that's another misconception I think also. So for example, we do know that babies who are even in the NICU, babies born early, once they are held by their mother, their heart rate goes down. We have scientific evidence how important this is, even for very, very premature babies who are just born. So imagine babies who are neglected, babies who have mothers who are depressed, babies who live in poverty and are hungry and have, a lot of chaos and confusion in their environment. All of those things are negative experiences that impact the brain. So what happens is that there are, without going into a lot of detail, so there are these, neural connections, synapses are forming, and hundreds of thousands are happening. And then what happens is there are also these proteins that get released in the brain that actually signify what kinds of responses are there and what the brain should do with those responses, just for a watered-down version, and also so it's not boring for you all. So what happens is that the proteins that are released into those synapses and connections, again, make a very big difference whether those responses are positive for experiences for the baby and toddler, for example, or negative. So, and what happens also in the brain is a lot of the synapses are overdeveloped and they are then pruned. So if you have negative experiences, oftentimes these experiences are not pruned and lead to long-term detrimental effects. So I don't know if that answers some of that.
Yeah, can you talk a little bit more about how this brain development, how does that then translate into a young child having mental health needs?
So let's talk a little bit about that. So oftentimes, infant mental health is very important. Often another misconception is that infants can't have mental health issues. And in fact, yes, they can, because if you have a baby, again, as I mentioned, who is neglected, abused, suffers some maltreatment, is in a very chaotic environment. So, we know children who are victims in wartime, for example, as well. They develop something called toxic stress. And toxic stress, again, there's a lot of research based on this, and it actually does affect the brain. So when children, let me just give you an example. So there was a 9-month-old who was part of an intervention program. She was in part of the intervention program because her mother had issues around substance abuse and neglect, and the baby was placed from birth with the maternal grandmother. The mother went through treatment, and she was part of an intervention program learning to interact with her baby, who was 9 months old. She had a very difficult time. She really didn't she blew bubbles and said, "Is once enough?" And it was just very difficult for her. The baby was extremely engaging, serving all the time, serving, and not getting much back. But the baby was still developing typically. We went back to have another follow-up with this mother, and she was gone. So the mother was gone. The maternal grandmother decided to turn the baby over into foster care. So we then followed the baby. She was part of an intervention program, as I mentioned. By 2 years old, she was in 8 placements. And so by that time, she was showing lots of distress, signs of distress, issues with regulation. She had another very important thing about serve and return that I didn't mention is this actually develops the attachment relationship. Attachment is actually built in the brain. So this baby had she had very insecure attachment, so attachment disorder. She was not responding consistently. She had lots of really distressful behaviors, and so was exhibiting what we consider to be toxic stress. So this is why it's so important to think about what happens to very young children in their environments. Obviously, I would like to say that's an extreme example, but it actually isn't.
Is it possible through addressing mental health to change, this impact on children and to have a positive impact on children once their brain development has been so impacted?
Yes. So let me show you. I forgot I have other slides here. So here's some. Got ahead of myself. So this shows some of that synaptic formation in the developing brain. You can see how much happens in the first year of development. So why it's so important, again, but you can also see that the brain is continuing to develop. So getting back to your question, yes, I think one of the problems is that the caseworkers, mental health workers don't often have the information that they need, and so thinking that multiple placements are not a big deal as long as the baby's placed somewhere, that's okay. We have the same situation, regardless of your politics, what's going on at the border for separation, that it would be okay to separate babies for months and months. But having said that, yes, it is possible because of what we know in terms of the developing brain that if a child is placed or put into an environment where there is responsive caregiving, that is the number one key that the baby, toddler can develop more typically responsive kinds of behaviors as well. So I think I also have, so again, this timing and dosage, does it matter? So the answer is, when does it matter? It matters most. The baby and young child can respond much more quickly if their experiences are positive early on. And you can see that the effort grows over time. But again, this is what is also very important. You never want to give up on a child, no matter what their experiences are, because there is always intervention, good intervention, evidence-based intervention always makes a difference. But again, the key is having a secure attachment or having an attachment figure, having responsive relationships, responsive caregiving relationships. That also, it makes a huge difference in terms of learning regulatory behavior. So social emotional development is the key to all educational, it's a foundation for education. You can not have a child who does not have really solid social emotional skills who is going to succeed in a classroom. Doesn't exist. So.
From a research perspective, is there a place where you think schools and or communities should start in addressing mental health?
Well, I think one thing is actually saying the word, infant mental health, and not disassociating a child from a family. So the context in which a child lives, including a classroom, is extremely important. So just to give you another example, I have a daughter who's a first grade teacher, and their school, not in Austin, but in the state of Texas, and the principal mandated that all kids dress up for Halloween and bring a book of their choice in. Well, she was in a school where lots of kids couldn't afford to do that and was very distressed about the situation. And so therein lies another issue, is where you have things where all kids want to participate because it's a holiday and they're supposed to wear a costume, but their family is either living in a car, can't afford shoes, there are so many other things that are going on in families' lives, and I think we have to really pay attention to the communities in which our families live, and also to provide support for the families who are having, whether it's transient or whether it's just long-term kinds of issues in their own lives. 25% of families live in poverty, and it's even higher for children under the age of 5. It's a very high number for the United States. And so living at the poverty line, below the poverty line, or just above the poverty line creates a lot of situations for families that involve incredible distress and stress in their lives, which impact the ways in which they parent their own children, or don't, because they're worried about paying rent or buying food or having lights in their apartment. So I think all of those things are just incredibly important.
Great, thank you. I know we'll have some questions for you. We're going to go to MJ for now.
I'll just put up that last slide, which I forgot I had, which has a lot to do with policy. But basically, just I think just say one more thing, just understanding the principles of neuroscience and taking those into the community and into mental health environments, such as schools, I think will help train our teachers, our communities, and actually just the lay population in general. So I'll stop there.
No, that's great. Thank you. So MJ, turning to you from a school perspective, you work at Mainspring School, which is a preschool here in South Austin. Can you tell us a little bit about the school, who you serve, and why mental health is such an important part of what you do?
Yeah, sure. So it's funny, your talk just set up everything for me perfectly.
And we've never met before.
And I'm sitting here like almost cheering. I'm like, that, yes. So I'm MJ Korpela, and I'm the Family Services Director at Mainspring School, like you had mentioned. We're a private nonprofit preschool here in Austin. And we serve, the majority of our kids are coming from what we would call like an at-risk population. Most of that is based off of income, although a quarter of our families are in the foster care system. We make a priority for that demographic as well. And then we also have some families that would be considered refugee families who have English as a second language as well. So, and that is the mission, that's the choice. We're here to serve those kids specifically. So I love this idea of mental health as that first, versus us talking about it as like something that as a diagnosis that happens in high school, but recognizing that it's actually an ongoing process, just like regular health. And at Mainspring, we have the 3 big pillars we talk about that are specific to this exact conversation. The first for our kids is just really high quality early childhood education, which is really hard to come by for the demographic that we're talking about actually. And actually here in Austin specifically, and Cathy will say more about this, but about 60% of our kids that are 6 or under are actually in poverty. So it's pretty substantial here. So really high quality education, that means we're the highest accreditation you can get. That means we don't skip corners on any type of services for our kids, which again is kind of a challenge given the fact that we're serving this population. The second one is basic needs. We had talked about nutrition. Our food is all farm to table. We're serving as many whole foods and fresh cooked meals as we can, because we know that artificial colors and artificial flavors and that type of stuff can really mess with children who are already having a ton of stress and maybe have some high cortisol levels. And the third one, which is where I come in, is a trauma-informed program focused specifically on attachment and coming alongside our families, because we recognize that our children are not alone on an island. They are a part of a big system, both at school and at home. And so whole picture, what does that look like for attachment?
Good.
Yeah.
So let's dive into some of these different areas
Sure.
that you serve. So looking at your classrooms specifically, what are the teachers doing? What would we see in your classrooms that are kind of getting at this mental health component?
Yeah. So one thing we try to really really emphasize is that our teachers are the caregiver. So we are focused, we don't talk about mental health as much as we talk about attachment all day, every day. Our babies are with our teachers for 8 to 9 hours a day, every day. We, by design, we don't stop for the summer. We keep going. We have long days until about 5:30. Every baby is there. So anything that a parent would do, like a healthy attachment would do for these babies, that's what we're looking to do. That means physical touch. That means holding, even up to 3 and 4. Children learn to soothe by being soothed. And each child has, what we're learning is, this is very rudimentary, but if you can imagine, each child has like a certain amount of times they need to be soothed by an adult, right? And that number is that child's like number. Regardless of how old the child is, they still need that number of times to be soothed. So if we have a 4-year-old in our program that is crying in a corner like an infant, we hold that 4-year-old like an infant, right? And we're meeting the needs that this child is presenting versus just more of like a cookie cutter model for each kid. And our teachers are doing that on top of course, all the academic stuff that we're expecting of them. But I will also mention that the focus at the end of the day, you had said it perfectly, they're never going to be able to function in a classroom. They're not going to learn how to count or do ABCs if we can't help them find secure attachments with adults and regulate emotion in the first 5 years.
Right. And then addressing the basic needs of children, how are you doing that? Because as Anne mentioned, having food insecurity or poverty, that can all lead to this stress in children.
Yeah, so basic needs, we have a pretty serious case management program for every family, and it's just need-based. As a community, we're coming alongside parents and recognizing like, oh, this child's showing some food insecurity pieces, or we're just publicly saying to parents like, if you need anything, please come to us, and we will solve the problem. Food, clothes, a place to sleep, a bed. If you're living in your car, please tell me, and I will do whatever it takes to try to find you a safe place to be. And really the magic of that basic need piece is that if we can, we get them as young as possible. We get them at 6 weeks sometimes. And so it's a constant basic need being met for 5 years. So it's building upon all of these different, like, the needs that, like, all of us, for me, for example, I take for granted for my kids. We give them 5 years of that. Is really the goal.
And then, so you mentioned parents. You have a big program that's helping parents in addressing their mental health, which we know trickles down to children. Can you talk about what you're doing with parents?
For sure, yeah. So parent education, which is just as it sounds, we have a bunch of different education sessions and suppers and stuff, and we invite everybody to come in. We'll bring in speakers related to a number of different topics. We have a parent support group that is really parenting classes, and we use a really specific attachment-centered framework. It's called Circle of Security International. I mean, it's 12 weeks of, thank you. It's very evidence-based. Everything we do is, actually. And if anybody is interested in hearing more about, like, the actual programs that we're using, I can provide you with a resource list as well. But yes, we use Circle of Security International, and it is incredible. But it is literally just you and your child, and are you attuned? What is happening in the brains of each of you, and how can we make sure that you are able to meet needs because yours as an adult have been met? And it's ongoing. And my families often, within that 5 years, repeat this course 4 or 5 times. And then just in general, we're just focusing on relationships and attachment and building a support system. Another characteristic of poverty is that there's not always much social capital there. I know that if any tragedy ever happened, I have someone to call and say, hey, I need food, I need a place to sleep. Do you got a couple $100 for me? Most of our families don't have that luxury. And so we're also in school building that system. So if we can't meet basic needs, there are people around that can.
What kind of success are you seeing, or what evidence is there in your school that tells you this approach is working and this is helping the needs of the children?
Very basically, unfortunately, I wish I had the exact statistic off my head, but it's like 90-something% of children in poverty hit that kindergarten stage and are not testing on, like, age level with their more affluent peers. And when I say testing, I mean, again, across this big, all different categories. So we're talking about academics, but we're talking about cognitive development, emotional regulation, all of this. And ours are actually 100%. If we have them for more than 2 years, they leave Mainspring testing ready. So that's just a basic, right? And that's not through, like, rigorous academic programming. It's through attachment. It's through basic attachment.
I'm sure if there are people here who work in preschools, you may be thinking, this all sounds great, but I'm sure there are a lot of challenges to offering all these services. Your role alone is pretty unique. Can you talk about some of these challenges, and how are you funding all this? How are you making it all happen?
Oh, yeah, the challenges. Basic challenges funding. We're a private organization, and there really isn't universal funding for us currently. We use some childcare subsidies, which has some limitations. One being it just isn't covering the cost of care. We have some federal money coming in for Head Start. There's that. So it's funding just in general, because we're pretty admin heavy. You know, like you said, most preschools don't have a full-time clinician that's available for staff all the time. It's that. We recognize that we're primary caregivers, so we're open all year round on 8 to 9 hour days. We don't take vacation at Christmas. We have a couple days, right? But we're not taking weeks. We don't have a summer vacation. So our teachers are tired. We ask a lot of them. We ask them to be emotionally present and physically available, and we're saying, meet these needs all day. So we ask a lot of them. So that's it, is staff that is exhausted and depleted. I think one thing to really keep in mind, too, is, like, we have 100 kids. And we have, just full disclosure, our yearly budget is $1.2 million. And a lot of times when we're talking about education, we're looking for, like, big numbers. Like, what program has the smallest amount of effort but touches the biggest amount of people? And unfortunately, It's just not, it doesn't work that way. You need prolonged, long-term, first 5-year type of intervention. So we have 100 kids, but really any given year, we're turning out 17. And we just put 1.2 million into that year, right? So convincing people that that's effective and worth it is a really big challenge too.
So for other schools or other teachers out here who are working in schools, if they do want to start implementing some of these programs, what would you recommend? Where should they start? What might be the most manageable?
Yeah. I would just, one, give yourself permission to focus on emotional needs. There's so much pressure. I think a lot of times, especially in big classes, we think of like, well, I can't stop and like solve this child over here like crumbling in the corner. I gotta keep going. I have 20 kids and I gotta teach them how to count. But I promise you both for the child that is there crumbling and for the rest of the group to see you meeting those needs and to be a part of it and to have this mentality of like, we are in this together. Long-term outcomes will be better than I can't with you right now because I have to teach the rest of these kids to count. So to start, give yourself permission to focus on attachment and emotional needs.
Great, thank you. I know we have some questions for you, so we'll get to those at the end, and we'll turn to Cathy right now. Cathy, can you start by telling us about your role at United Way and what you're doing with Success by 6?
Sure, thanks, Jackie. I'm the Vice President for Success by 6 at the United Way for Greater Austin, and in the Austin, Texas community, we are the backbone organization that convenes our community's strategic plan, and we have a coalition of organizations that have been working for more than a decade on 3 different versions of this strategic plan, with the North Star being that all children in our community enter kindergarten happy, healthy, and ready to learn. And we have a comprehensive framework that looks at healthy beginnings, safe and supported families, quality care and education, and safe and stimulating communities. And throughout these buckets, we have infused practices of supporting promotion and prevention in the mental health area. So how do we incorporate aspects of mental health, education, looking at the development of the whole child in the context of the family through these buckets?
Great. And what are some of the programs that are specifically trying to address early childhood mental health? And I know some of them, as I mentioned earlier, when I met with Cathy first, I was really interested to hear about some that may not seem like they're directly working with children, but they may be working with staff members or Head Start teachers, and they actually do trickle down. So what are some of those programs?
Sure. Well, we're excited that this past year we launched a new program in Travis County called Family Connects, and that's a universal newborn home visiting program at scale. Every family who gives birth in Travis County will have the opportunity to have a public health nurse visit about 2 to 3 weeks after birth. And it's universal because we know that for all families, the birth of a child is one of the most vulnerable periods of time. And the nurse goes through a 12-point checklist with that family to look at everything from, are their basic needs met? How is mom's health? Has she made her postpartum checkup? Is she suffering from any maternal depression? Looking at baby's health, developmental milestones in that early time, and other aspects of their home needs, and then can make closed-loop referrals to the service providers in the community. We also hope that through this program we'll be surfacing where are gaps in services, so if we can't make a referral or where are we realizing we don't have this capacity to meet those needs. So we're starting early, and then we offer programs that are evidence-based home visiting programs, really making sure that the providers in those programs are addressing their own mental health and self-care issues and have resources there. And then specifically, the area we've focused a lot of time and philanthropic dollars has been in our child care system. Texas has a fragile and fragmented child care system that is woefully under-resourced. And we are a partner with Mainspring, and so they're one of the stellar high-quality centers that we support in the community. But we have launched, about 4 years ago, we have a mental health consultation partnership with the Austin Child Guidance Center. And they have 2 infant early childhood mental health consultants who visit the high-quality child care centers in the community. We are serving about 8 this year, including some Head Start centers. And those consultants build a relationship with several of the classroom teachers. They visit with the director and identify classrooms that have significant needs. And they really go in to help build the capacity of the teachers in that classroom to meet the needs of their children. About 3 years ago, we started hearing from directors and teachers that they were just really struggling meeting the increasing needs of children that were coming through in our child care system, and that was harder and harder to meet the individual needs of children. And we don't have the capacity to do that treatment model where, you know, the teacher keeps teaching and someone comes and pulls out Johnny and tries to help them manage what's happening at that time. But instead, we really need to build the capacity of the staff in the centers to address the needs that are surfacing across all the children that they're meeting. And these centers are really under-resourced. And while the staff receive a fair amount of training around social emotional learning and development, you know, they are coming with their own challenges, their own stress, and their own challenges meeting their own basic needs because they're woefully underpaid. And so we're trying to work with them as well. We empower them with an explicit curriculum, second step, which is what our school district also uses in the early years for that explicit teaching of social skills, self-regulation, feelings. But then we've also started providing training with conscious discipline, which is a framework that really focuses on having the staff in the classroom stop and pause and understand where they are coming from and making sure that they're regulating their own behavior before they manage what's happening with the children. So those are some of the pieces that we're really looking at. We think that's really important that the teachers are able to meet their own needs so that they can meet the needs of the children that they're working with. And I believe a few years ago, there was a study that about 24% of the staff members in Head Start programs were identifying their own symptoms of depression. And so Head Start actually has mental health providers on staff. So if you think about that number in Head Start and we think about our smaller, more isolated child development centers that are functioning with maybe less administrative support, we suspect that that rate could be even higher.
What kind of success are you seeing through these programs? Are there certain programs where you are seeing more success? And also, how do you measure it? Are you looking for signs that the children's mental health needs are being met, or are you looking for changes among providers and teachers?
And to be quite honest, that's still a challenge for us to work on how do we measure that. We do use the DECA, which is the Devereaux Early Childhood Assessment. It's a rating scale that teachers and families can use, and it measures things like attachment and self-regulation and behavioral control. It's a great tool for helping the staff and a tool for them for working within the classroom, but as far as an outcome measure, an impact measure, because the teachers are scoring children pre and post, there's different factors that may play into that don't make it reliable for us to measure the outcomes. We're currently working with a UT professor on looking at how we can operationalize more data. As I said, most of our programs are philanthropically funded. There aren't a lot of public dollars to support these kinds of programs. And so with philanthropic dollars, we have to demonstrate sustainability. We have to demonstrate impact. But this is one of our challenges that we're continually working on.
Are there other challenges in the community? You're working with so many different organizations. I imagine other communities may want to think about programs that you all are doing or other programs I've heard of to start addressing mental health. What are some of the challenges that are really real in communities as you try to address this?
Turnover and affordability. In Austin, as our community has been growing, it's harder and harder to make a living wage here, in both in childcare and other social services. And so, while we're trying to build capacity in our staff with mental health consultation, and our focus is on empowering the teachers, when we're facing significant turnover, then we're continually starting from ground zero with new staff members. And so again, that's, how do we measure the impact of those dollars? And just trying to find dollars to invest in these. I think the other piece is because the early childhood space is so fragmented. We have home visiting programs in one area, and we have child development centers in another area, and families have the challenge of navigating all of these systems. And we aren't able to track families, track children, and track data around them. So it's just hard to make that all those dots connect effectively.
Is there one area or a program or a place you would suggest communities start if they want to focus more on early childhood mental health?
Well, I failed to mention that we do, through Austin Child Guidance Center, they have convened the Trauma-Informed Care Consortium in Austin, and they have been convening mental health providers to really look at how can we, as a community, use a trauma-informed lens and spread that, have comprehensive views of ACEs screeners, and try and really provide professional development so that anyone who's working in this space will at least bring a trauma-informed lens to that work. So I think looking for who has the capacity in the community to be that backbone in that space, and then try to, as much as possible, collaborate to use resources effectively to distribute that information so that it's relatively consistent as people navigate through different systems.
You mentioned a few things in there like ACEs, trauma-informed. That's actually one of the first questions we have on Slido. And I don't know, can we get the Slido questions? Perfect. So I think, Anne, this may go to you first, but feel free to jump in, either of you. Can you clarify the difference between ACEs, trauma, and toxic stress?
Well, it's a really good question. So they're intertwined, right? So I think all of those things do make up ACEs. And for those of you who don't know what ACEs are, those are adverse life experiences. There are also PACEs, which I don't know if you've heard of those. And I'm trying to remember what the P stands for, but basically like preventative life experiences. So it's basically like what buffers. So there's actually a book that's just been published, and I can't remember the name of it, but Jennifer Hayes is one of the authors of this book. And so she and her colleagues at Oklahoma State University looked at, they developed a program and then wrote a book about it, so that you might have in fact, almost all of us have some adverse life experience, which doesn't necessarily mean that you are going to have long-term toxic stress. But you might have had buffers, which might have been having a high-quality early intervention program, or you had an attachment figure who was present in your life from a certain period of time. You had access to, intervention, having a therapist or what have you. So all of those things buffer, perhaps these adverse life experiences. But taken into account, an adverse life experience could include toxic stress, maltreatment, neglect, and so on. So I would say that there's not, it's blurry, and probably, a lot of those things might be considered in the adverse life experience, but doesn't mean you have to have that to have an adverse life experience. It could be other things, including homelessness or poverty.
I was going to ask, what are some of the most common adverse life experiences, especially ones that, I know the general population might experience?
Harsh parenting, dysregulation, having a disorganized attachment early on. Poverty is definitely one that can add to some of those. Neglect, maltreatment, and maltreatment could include both physical, verbal, and sexual abuse. Oftentimes, maternal depression. So sometimes adverse life experiences, for example, even just being a witness to domestic violence and not experiencing domestic violence is a very high adverse life experience. So, and even verbal abuse is, oftentimes people think like, oh, harsh parenting, it doesn't really mean anything. It actually, there's scientific evidence to document that it actually has significant detriment to a child's well-being.
Thank you. Next question. So MJ, I think this is for you. How do you get parents to show up for the support groups and classes?
Yeah, so this one is big, and I'll try to answer it quickly. A lot of our parents are involved in programs that are performance-based. You have to do this, you have to make this, you have to show up here every couple of months, you have to report this. A lot of their experiences with providers, whether providers are meaning to or not, can be really shameful and uncomfortable and frankly really judgmental. So from day one, when the very first time I meet a family, I'm the first point of contact and the first they come in and they meet with me. From day one, we're going about it as like, this is a partnership. You don't have to prove anything to me, and you're now part of us. You're one of ours. So that's the first step. Basic stuff, childcare and food. Everything we do has childcare and food, because childcare, how are you going to a meeting without it? And they usually happen at 5:30. They need to be fed. So those basic things. And then it goes back to this like long-term piece again. I know these parents for 5 years. I see them every single day. And I'm not always asking them for something. I'm not always telling them something every day. It's, hi, how are you? You look great today. What's going on? I'm creating a secure attachment with parents, essentially. So they want to show up, and they're comfortable showing up.
And there's a follow-up question, too. Do you provide the classes for free?
Absolutely, yeah. Yeah, if you're part of us, everything that we offer is yours.
Great.
Yeah.
All right. And also, if anyone has a question you want to ask on the microphone, there is a microphone right there in the middle, so feel free to get up if you want to. All right, here's another top question. I think, Anne, this is also for you. You spoke about misinformed provider practices, such as giving infants multiple placements. Actually, all of you kind of spoke about that. Are there others, and maybe for all of you, are there other misconceptions or practices that you want to end?
There are so many. Would you like to start?
Well, I think something that you said about holding a child is problematic. And I think what you stated, that just holding a child who is having some difficulty, whatever it might be, falling apart, having a tantrum, ignoring them is actually the worst possible thing that you can do. So again, we help regulate children, and their brains get regulated when they have responsive interactions, whether that be a teacher, a caregiver, whoever it might be. And I think you probably have more to add.
Well, I think this had talked about foster care and placement specifically. And so, yeah, while the foster care system is doing some effort now to educate about attachment and longevity, yeah, definitely these multiple placements and definitely the, I just blanked on what I was going to say. I think keeping school in mind when you're talking about a full picture for children when you're talking about misconceptions and practices. So often caseworkers or whoever's working with their kids, both in foster care and just in general, are really considering early childhood schools as just like a babysitter, and it's not part of the picture. They're not really checking at where these kids are enrolled. They're not really taking our perspective as providers about what's going on with these child and what behaviors that they're presenting with. So that is like one of those practices I really wish that the education setting or childcare setting would be more involved in the process.
Yeah. Cathy, do you have anything to add?
I think it's mostly just recognizing that children's behavior is communicating. It's communicating a need. And so understanding where that child is coming from and pausing before you react to that behavior by trying to understand what is the purpose that behavior is serving to communicate.
Great. All right, go ahead. Yes.
I was wondering, this is a sort of cultural question. I was wondering if we're seeing more attachment problems in middle-class populations. I mean, I watch people on their devices and worry about, is our society becoming less communicative and less nurturing? And so in terms of a cultural trend, is this actually happening more often? I used to be a school psychologist, and teachers would say kids are coming in not only with less verbal skills, but really less social skills, less regulation. So my question, you might want to comment on sort of the cultural trends that make this situation even more pronounced, and yeah.
Well, I would say that I know with a lot of our high quality CDCs, they've actually now had to post signs that say, don't be talking on your phone or staring at your phone. Come in, leave your phone in the car, and greet your child. You know, leave your phone. So I do think that it is pervasive that, you know, we have many demands on our time, and making that relationship with the child priority one is getting harder and harder with all of the demands on people's time. So we have an urgency to make sure that people understand this brain science and the priority that those early years are for forming that brain and architecture. And I think that that's an opportunity for all of us.
Are those high quality centers you mentioned, are those serving a certain population, or do you see all groups and cultures in there?
Well, through our United Way work, we primarily try to target centers that are high quality and serving children from vulnerable populations. So they're supporting families who are relying on child care subsidies, and that they are trying or on the path to becoming accredited for quality.
Go ahead.
I'll just briefly say, so there's something called a still face paradigm. I don't know if any of you know about it. So you actually, you have a parent who is interacting with their child on camera, and then you film the parent, and they just have to have a still face, which means no reaction to the baby, and then you look at the re-engagement when the parent re-engages again, and look to see what the baby does. It's very powerful. You can Google it and watch a clip. I suggest you do it. Our lab is actually using the still face, but now having the parent on their phone to show, to see what happens, so that the parent, rather than just the baby's looking at the still face, would be looking at the mother and we use mothers because that's the paradigm, on their cell phone for 2 minutes and see the disengagement. So we hopefully will have a study published on that soon.
MJ,
My first response after you both have commented, I'm definitely seeing and I love the still face paradigm. My first response as a proud millennial here is that I kind of feel like, this is just me, right? I kind of feel like the technology and the cell phone is not necessarily the problem in itself. I feel like my insecure attached moms would have checked out anyway. I think the phone is a way to do it, I guess, is where the space that I'm at. And also, so Circle of Security International, which is my attachment-based program, and then TBRI out of TCU, which is my trauma-informed care program. They'll both tell you that the percentage of times that a parent does need to look up is actually only 30% of the time. 30% of the time. You can miss the not 70% of the time. So I guess bringing that all in, I'm interested in hearing what your research finds, because my first response is I think my moms would have checked out anyway. I think especially my dismissively attached moms, I think the phone is just a really convenient way to do it.
We have a really great question here. I'd love to hear all of your perspectives on what needs to be taught to pre-service teachers in order for them to contribute to the mental health of our students. So maybe top 3 things.
It's hard to put it into 3 things. Attachment seems like the most obvious answer to me.
What do you mean by that? What would they be taught?
Attachment theory specifically, and the way that secure attachment is formed, and the way that as caregivers we should be responding to emotional needs as much as focusing on our education curriculum.
I would just say number 2, although I would probably put this 1, is that it's critically important for pre-service teachers to understand the importance of early intervention. what early intervention is, what needs to happen, and why waiting is so detrimental to a child's well-being. I mean, we see immense and just incredible gains for young children when they are placed in an early intervention.
I think the fundamental principles of child development, that brain science of the first 5 years, and those principles of child development and the critical foundation of social emotional development, because it underlies all later academic progress, and the practice of checking in with your own self. I remember the stress of being a first-year teacher and how you have a million demands on your time, and really having the capacity to pause so that you can respond genuinely with a child.
Great. This question is fitting since we are at the policy forum. So we've talked about programs and some policy, but this is great to kind of hit this on the head. What policy changes at a local, state, or national level could improve this issue, could make it more, I assume that means, to bring more attention to or to kind of address early childhood mental health?
I would say funding for childcare, affordable, accessible childcare, because the fundamental cost in childcare is the staff, and they are inadequately compensated. Most of them are making less than a living wage, and so we are creating stress in their life by making them have to live in these circumstances and expecting them to be warm, responsive caregivers for our most vulnerable children. And so until we can adequately compensate staff and provide them appropriate training and supports in the classroom, I think that it's going to be hard to improve anything else.
I would just say that actually at the national level, there's science that has been presented. So basically, it's implementing policies that we know that are important. So I think the data is there that would support at both a local, state, and national level. But I think we have to start sort of nationally making policies mandated for high quality access to all high-quality early childhood programs, and also having a very mandated infant mental health programs that address the needs of families.
There are a few states that are incorporating an early childhood mental health consultation program. I know Ohio has essentially a hotline that service providers can call and request a visit, because I think sometimes having that outside perspective, so someone can come in and look at the dynamics and the needs in the classroom also. So policy change to really make this a priority.
California, we just wrote about this at the Hechinger Report. California just implemented a statewide early childhood consultation model. So child care centers that receive state funding will receive a boost in funding if they have a mental health consultant who will come to the child care centers aimed at working with teachers, so helping teachers kind of work through the stress they're feeling, any depression they're feeling, so that they can then go into child care centers, go into their classrooms, and they're just more ready to deal with issues that arise with the children and to deal with various behaviors. And I visited some centers that were doing this in the Bay Area, and it was almost like therapy for the teachers. Like they would sit and talk about how they felt, and they were like, no one asks me this. No one is asking me how I'm feeling. And you could see kind of a weight lifted, and when they were done, they went back into their classroom, and they were refreshed and able to deal with anything that came up. So I'm glad you mentioned that. MJ, did you have a policy suggestion?
Both of what they mentioned, the funding, starting to consider early childhood as education and really putting the investment into it in that way. And then also, the information is there. It's not new. It's talked about in the community. So let's start making some changes at the national level.
All right, we have a question at the mic. Thank you for waiting for so long.
No problem. Thank you all for being here. I have a question that's oriented around the mental support for the teachers and providers. You've talked about the identification with mental health consultants, as well as the need to check on oneself in terms of managing your own mental health. But are there any interventions in terms of the communities within like a school like Mainspring, or external interventions in terms of providing those supports for the teachers?
I know that through the United Way in the past, we've had an opportunity to actually provide some grant funding so that staff could go to another service agency for actual mental health counseling. We also offered it to families, but unfortunately that funding source expired, so we're no longer able to provide that. And I think it's a real deficit in our community because many of our child care providers don't receive any health benefits through their work. But I do know our local Head Start program has mental health support on staff, and that they have an EAP program, and they also have I think Head Start nationally has committed to a wellness program for their staff because they have this robust data showing that it's so incredibly needed. But again, it's more, we have some good examples, but it's not the norm.
Yeah, just to piggyback off that, we actually took advantage of the program she's talking about. So for a while there, a lot of my staff was being served through external providers weekly, just meeting with a therapist, just checking on your mental health. And then internally with Mainspring, so I'm a clinician and my office is open to our staff, and they take advantage of that as well. Again, we're small, right? So that's doable because we have 18 full-timers and then just a couple more floaters and stuff. So, and that even in itself is a really heavy weight for me to do the families and the teachers. So I would love to see just a person, a clinician staffed at schools for staff. Not the school counselor that's there for kids, but for staff. And unfortunately, there isn't really great resources there for that. There's not a lot of support for teacher or provider mental health at this point.
So this question has gotten a lot of upvotes, so I thought we should address this. Even though we are talking about the earliest years, early childhood does span, through age 8. So can you offer suggestions for how to support slightly older children, so maybe 5 to 7, with attachment difficulties in a school setting?
I would just remind everybody that even though a child might be 5 to 7, actually, their emotional age probably doesn't match that if we're talking about attachment or trauma. So again, giving yourself permission to view the child as that child is presenting. Are they acting like they're 7 or are they acting like they're 4? If they're acting like they're 4, then treat them like a 4-year-old and meet the emotional needs in that way. And then I would point you to the Karen Purvis Institute of Child Development. It's out of TCU here in Texas. There's a program called TBRI. It's Trust-Based Relational Intervention. It is a whole model for working with kids because they say kids from hard places. That program has completely revolutionized my entire practice and the way Mainspring operates. And there's really specific strategies in there, but biggest thing is your kids probably aren't emotionally 5 to 7, so you really have to do some work to figure out where they're at, meet them there, and bring them up to 5 to 7.
And I think along with that, in a school setting, looking comprehensively at that child's community, who are all the different people that touch that child, so that you can build in some consistency for that child and involving the family, but looking at other social capital supports in that child's space to build in that support.
All right, any other questions for the mic before all right, we probably have time for one more question here. What changes would you like to see in mass culture to bring more attention or progress to this issue? That's a good one for all of you to kind of end on.
We talk a lot about mental health as a diagnosis. We talk about it, and similar to physical health, we're waiting until something goes wrong, and then we say we want to address mental health. We could have done it right the first time. We could have come into those first 5 years, could have done it right the first time, and you wouldn't be seeing what we're seeing now with all these big mental health concerns. So I wish that the conversation when we talk about mass culture was more of a proactive, preventative type of intervention than waiting until someone is profoundly mentally ill.
I would agree, and just also thinking about early infant mental health as being a component of everything we should address. So when we're thinking about social emotional development, that's included infant mental health, looking at also the family's mental health as being inextricably tied to that. So when we talk about attachment or trauma, we're not just talking about an individual, we're talking about relationships that are also impacting and bidirectionally influencing what is continuing to happen or has happened.
I know in Alberta, Canada, they've had an initiative called the Brain Story, and they, as a whole community, have embraced informing everyone about that brain architecture and the brain development. And I think as a culture, if we would focus more on the critical time period of birth to 5 and make that a conversation in the workplace, do we support our employees as parents and caregivers so comprehensively throughout our culture, value the importance of the earliest years of parents.
Great. That's all the time we have. Please join me in thanking our panelists.